Good afternoon. My name is Duane Musser, and I live in Arlington, Virginia, and I was diagnosed with celiac disease in 2008. I also have a daughter who was diagnosed with celiac at age 5.
My name is Marc Jarjour, and my eldest son, who is 14 years old, was diagnosed with celiac disease a year ago.
Hello, my name is Kelsey Smith, and I was diagnosed with celiac disease in 2016.
Hi, I'm Josh Denney, and I live and work in the Washington, D.C. area. I have a teenage son who was diagnosed with celiac 3 years ago, and I started volunteering with the Celiac Disease Foundation about a year and a half ago.
I welcome the opportunity to become a patient advocate at the first Patient Education and Advocacy Summit held by the Celiac Disease Foundation in 2020. This was a very rewarding experience as it gave me the opportunity to tell the story of my family's struggles with celiac to members of Congress and congressional staff. I was able to relate how the various public policy priorities that the Celiac Disease Foundation is pursuing in Congress and with the National Institutes of Health are needed to help improve the lives of people with celiac.
I got extremely interested in what the community was doing to find a treatment. I was incredibly pleased when I discovered the passion and all the great initiatives that the Celiac Disease Foundation is doing, including the patient registry, the collaboration with physicians, the patient recruitment, and several others. So I immediately decided to be an active participant with the foundation.
So when I realized that there were ways I could get involved through CDF, I jumped in 2 feet. I participated in the 2019 Advocacy Day here in Washington, D.C., where I was able to share my personal story about the impact of living with celiac disease with U.S. congressional staff. I was also able to participate in a day of training. So I learned more about CDF, about the different trials that were going on, and about how to better lobby and connect with local legislators. And I helped train other folks who were going through the same experience as I was. Since then, I've remained in contact with my local representatives and senators about who I am and what I expect to see from them when it comes to their time in Congress, especially their support of funding for celiac disease research.
Besides being a member of the steering committee for today's summit, I've primarily been working on getting a celiac disease caucus started in the United States Congress. Congressional caucus is an opportunity for members of the House and the Senate to come together around a common interest or concern.
The extensive information obtained at the summit has enabled me to be a better advocate for myself and others with celiac in many ways throughout the year. While I have learned a lot about celiac since I was first diagnosed 13 years ago, I'm amazed by how much we still do not know about the disease.
Celiac disease advocacy is an especially important step in raising awareness that celiac is not a fad diet, but a serious medical condition with life-changing impact for both patients and caregivers.
I know that our government has vast resources. We give it to them every single day via our taxes. And it is very easy for things to get lost in the shuffle of running a government. There are a lot of different focuses that the US government has. And if you are not constantly reminding them of what is important and what the priorities are, it's easy to get lost in the shuffle.
And you can help with this effort going forward from today by contacting your members of Congress in your state and asking them to join the Celiac Caucus.
As a government relations professional who has worked in policymaking for many years, I can tell you that democracy really is a participatory sport. We need more patient advocates so our collective voice is heard loud and clear in Washington, D.C.
I personally know how confusing and intimidating advocacy can be, especially when it comes to contacting a U.S. representative or a senator. But I encourage you to set a small goal and find a friend. You don't have to go at this alone, and having a partner can provide you with confidence and show that what you are doing is part of a group effort. It's important to remember that you're not having to say anything special or incredible or different. You just have to share your own story.
I encourage all of you to leverage your skills and resources, whatever they may be, and be an active participant in this journey. Every action, every phone call, every dollar invested will bring us one step closer to finding a treatment and completely changing the life of the patients suffering from celiac.